And I'm just going to dive in and do just a very brief introduction. So if you are new to my page and my platform, I'm Dr. Earl Turner. I'm a licensed psychologist and also the creator and executive director for Therapy for Black Kids. And so we have been around for approximately a year now, and our main mission for Therapy for Black Kids is to offer resources through education information on our Instagram page here. We're also on Facebook as well. And we really want to promote healthy emotional development and resilience among youth, specifically Black youth and their families. And there are a number of ways that we do this through hosting live events like this to educate parents on signs and symptoms related to different mental health diagnoses, as well as providing some conversation starters, effective tools around parenting kids with different types of mental health conditions, or just parenting in general. And so if you haven't checked out our website, you can go to the link in the bio and visit us at therapyforblackkids.org and learn a little bit more about us and our platform. I'm going to be talking about mental health post-pandemic. I guess we're post-pandemic at this point, even though we're still navigating some of the effects of the pandemic. But particularly having a conversation around how do we help youth navigate life post-pandemic, dealing with some of the challenges and even the readjustment to life after the pandemic. So if you have comments, questions, feel free to post those in the chat. I'll also come back to some of those things throughout today if things pop up as I am going through some of my talking points. And I'll share some more time at the end as well to answer some additional questions that you may have. So I decided to do this live event today because I know that there have been a lot of data over the last couple of months coming out around mental health among youth. So the U.S. Surgeon General released a report earlier this year identifying a crisis related to youth mental health. And more recently, there has been a task force that has recommended that all youth, and so ages 8 to 18, be screened for anxiety. And this is through their primary care physicians, regardless if they are showing any signs and symptoms related to anxiety. And so I think that's a really important recommendation. I know we talk a lot about mental health and the need to have screenings around this to see, if everyone is doing okay. I talk a lot about the need to have these mental health checkups, similar to what we do with our physical health. And so for me, it was really important to see this recommendation from that task force to say, hey, kids are struggling. We're not sure which ones may need a treatment, but we want to sort of check in to see what are the levels of their anxiety that they may be experiencing. And one of the things that I wanted to sort of point out when it comes to this idea about screening for anxiety is really just recognizing that we all experience some level of anxiousness or worrying about situations, so that there is the fact that this is a normal reaction to things that happen in our life that may cause us some type of stress or worries about different situations or events. However, we know, and particularly for me as a psychologist and mental health provider, that sometimes that anxiety can cross over the threshold to be a disorder or lead you to experience significant difficulties in your life and impairment. And kids can also meet that criteria where they have an anxiety disorder. So I think the recommendation from this task force is helpful. One of the things that they talked about and identified was that their goal for this recommendation is to reduce shame around having anxiety and to have more conversations around anxiety, particularly for kids, so that way if kids are struggling with some anxiety, that they don't feel bad about that. And so I think that is helpful to normalize this conversation around things like anxiety or mental health difficulty, so that if someone is struggling, it makes it more easier for them to want to be able to seek help. And so that is something that I really appreciate. And one of the things that I continually talk about when it comes to mental health in kids, because I think we do have to make sure that we let kids know that it's okay if you're struggling, and that we as adults and as parents can help them to get that support that they need to address those specific concerns. One of the things that we know in regards to things like anxiety or other types of mental health conditions is that just because someone is screened and they exhibit some symptoms of anxiety, that doesn't mean that they have an anxiety disorder or that label. So the screening is just a way to say, hey, something is going on that is not typical in terms of our emotions, and that we want to get some additional evidence or have a full psychological evaluation to see, is this anxiety crossed over into what we would consider to be an anxiety disorder. And so that is something to keep in mind, that just because someone screens positive for anxiety doesn't mean that they have an anxiety disorder. That is one of the reasons why we at Therapy for Black Kids really want to continue these conversations, try to offer some resources, try to provide spaces where families can get the support that they need, and really understand what can you do in the interim. If you can't find a therapist, how can you help your child to manage some of these things? So what I want to do is just sort of talk a little bit about that. How are we going to help our youth to navigate life and navigate struggles when they may be experiencing a mental health challenge? And so one thing that I talk about often is that as a parent or an adult that's playing a significant role in a child's life, is that we have to model healthy coping practices. And so kids are watching us as adults and as parents and how we experience stress that we're going through. And if we are not modeling for them how do we cope, or what are some ways to cope with these different types of challenges, then they are also not going to be able to learn what are some ways to manage some of these stressors that they may be going through, or how to cope with their own anxiety. And so I think for me, in terms of the modeling of healthy coping practices, it's really helpful to also verbalize or say how you're coping or managing these things, as well as how you model and demonstrate for the child how to cope with these things. If you are experiencing stress or worrying about a particular situation, that it's helpful to talk out loud, acknowledging that stress or worry, and then also state how you're going to help yourself regulate and manage that stress. So if I am stressed out because of, let's say, financial stressors, I might say, I'm really stressed out, about paying all of these bills right now. But you know what? It's going to be okay. I'm just going to set up a plan to figure out this, and I'm going to make sure that I don't think about it too much, that it continues to worry me. So that way the child knows, like, hey, yes, stress, anxiety, worries happen, that's normal, but also this is how I'm going to cope with that. And that is really important to do that piece, to really help the child to learn. These are the things that I see that my parent is doing to be able to help themselves manage whatever these things are that they are stressed out about. Another thing that I think is really important in terms of helping to reduce stress, reduce some of the anxiety that you may be experiencing, is that we really do have to identify a healthy self-care routine. And so that includes a number of different practices that you can identify for yourself and for your child that can be helpful. And for me, the idea about self-care is not necessarily focused in on, I need to go, to the spa, or I need to treat myself to some fancy meal or a restaurant. That can be great and can be some of the things on your, let's say, list of self-care practices. But there are some basic things that also are really important to your self-care as well. I think one of the most important things is sleep. We are in a very busy society. We as adults are sleep deprived. Kids are not getting enough sleep. And what we know from looking at the research is that sleep plays a significant role in terms of your emotional awareness and management. And so for me, it's really important to make sure that as a parent, kids are getting 8 to 10 hours of sleep. And obviously that number can vary depending on the age of the child, but you do want to check in to make sure that your child is getting adequate sleep. Because if you are not getting enough sleep, that is going to make you more on edge, more potentially irritable, and not be able to manage some of the things that you may experience in life when it comes to things like stress or anxiety. And so I would say check out the Academy of Pediatrics, and on their website, if you search sleep, it will give you some guidelines around that. But in general, 8 to 10 hours for kids is probably the range that is appropriate. And obviously, younger kids are going to need a little bit more sleep than adolescents. But do make sure that your child is getting enough sleep, because that is going to be important to their mental health. Also, we know in terms of self-care practices, what we eat and the amount of physical activity also is helpful to us regulating our emotions and our mood. And so try to maintain a healthy diet and what you're eating. Obviously, I am not a nutritionist, so I can't give you the specifics about that. But I do know from looking at research that what we eat does play a role in terms of our mental health. And so that is important to try to balance. Everything is about balance in terms of what we eat. And the last piece I think that is really important when we think about self-care practices is giving yourself breaks and giving kids breaks. The last thing that I want to talk about in terms of helping kids sort of cope and navigate life is if you notice that your child is struggling, maybe they are, stating to you that they're stressed out. And I know that sometimes for some parents for a really long time, it was hard to understand, kids being stressed. Like, what do you have to be stressed about? You go to school, you come home, you play with your friends. You shouldn't have anything to worry about. But we know that kids do have stressors, things like bullies. We know kids, particularly black kids, may experience discrimination, racism from both their peers as well as adults in the classroom setting. And so those things can be really stressful as well. And so if you notice that kids may be, distancing themselves, particularly adolescents, a little bit more than usual, check in on them. If kids are not eating adequately, so they don't have an appetite or they want to eat all the time, those may be some signs of some difficulties. And acting out behaviors, particularly for younger kids, because they don't have the language to tell you that, I'm stressed out, I'm worried, somebody's bothering me, etc. They then may begin to have disruptive behavior problems. So being aggressive, being angry towards you or towards siblings or other peers. Those may be some warning signs that you need to look in on as well. And so if you see some of those things, either take your child to get a psychological evaluation so that you can understand, is this something that is being triggered by something in the environment and, it's going to get better within a short period of time, or has it met the level of a diagnosis and it may warrant some therapy or some treatment to help give them some tools to manage and address those particular concerns. And so seeking help and getting therapy is really a resource for you if you can be able to access someone who can help you and your family. And the one thing that I want to sort of mention in regards to that is don't be afraid to ask questions if you are seeking therapy. I get a lot of referrals from parents about services, and sometimes they say, hey, I'm looking for a therapist for my child, Can you help me find someone? And what they sometimes don't mention is what are the problems that they're looking for to get help with. And so it really is important that you find a therapist that has that training and specialization in the things that you need. So we all don't provide services to everyone with different types of difficulties or challenges. And so make sure that you ask that therapist or mention to that therapist, hey, my kid is struggling with anger. My kid is struggling with anxiety. My kid is seems to be sad or depressed. That is really helpful to make sure that that therapist has that expertise and experience to actually work with you to help address that specific concerns. Otherwise, it can be a waste of your time as a parent to say, hey, you go to this person, you finally get an appointment, and then you meet them and they say, oh, I don't work with kids and families with these types of difficulties. So do let them know what you are looking for in terms of the types of help and services. Ask them what types of experiences do they have and what types of services do they provide. I usually recommend that if you can't email the therapist to say, hey, I'm looking for help for XYZ. Is this something that you can help me with? Try to give them a phone call or see if they offer a consultation. So a lot of therapists will give a free 15-minute consultation where you can have a conversation with them to let them know what are the things that you may be struggling with, what are the things that your child is struggling with, and also see if they are a good fit for you as well. So those are really important things to think about in terms of getting that help that you need if your child may be struggling with anxiety or some other type of mental health diagnosis.